Welcome to another episode of Health Talk with BMC. Today I'm joined by Dr. Zambezi. Welcome, Doc.
Thank you very much, Tari.
And we're going to be talking about an interesting condition called gastritis. Global statistics show that 8 in every 1,000 people are affected by this disease. And Doc, can you shed more light into this disease called gastritis?
Okay, so gastritis, it is a general term. It refers to a group of conditions which result in inflammation of the stomach lining. Some some people just call it acids. That's the most common term used by people, acids, right? So, but it's gastritis, which is that group of conditions resulting in inflammation of the stomach lining.
Inflammation of the stomach lining.
Yes.
Okay, so I'm trying to picture, we're living in an age where people Google their signs and symptoms.
Yes.
What are the clinical presentations of gastritis?
Okay, so gastritis, like I said, it is a group of conditions. So its presentation also varies. Some people present with nausea, vomiting, abdominal pain, diarrhea, bloating, and many other heartburn and other various symptoms. So it's also a variety of symptoms how people are present.
Oh, okay. And Doc, what is the root cause of these signs and symptoms that eventually show? What causes gastritis?
Okay, so the causes, again, there are many, right? We can look at infectious causes caused by infections, right? For example, H. pylori. There is a bacteria called H. pylori which causes gastritis. Gastritis can also be caused by chronic use of medications, mainly NSAIDs. For example, diclofenac, Indocid, Brufen, aspirin. Those are group of medicines. They cause gastritis if they are used for a long term. Gastritis is also caused by excessive consumption of alcohol, stress, and also cancer treatment can also cause gastritis. So there are many causes of gastritis.
Okay. And Doc, I know some of our viewers will not really like the alcohol part, but as you heard from the good doctor that excess use of alcohol will lead to gastritis. So Doc, what's the treatment plan? How do I get treated from gastritis?
Okay. So first of all, we need to diagnose, right? We need to find out to confirm whether it's gastritis. So for the diagnosis of gastritis, from first of all, the clinical presentation. After clinical presentation, we also do some laboratory tests, right? For example, we can do H. pylori. H. pylori, we can test the blood. There's a blood test, there's a breath test, and also there's two antigen test. So those are the three tests for H. pylori. We can also do an endoscopy, right? Upper GI, upper gastrointestinal endoscopy to confirm the diagnosis of gastritis. Then when we move on to treatment now, I can say to prevent or to relieve the symptoms, there are some home remedies or lifestyle modifications which people can do. For example, you have to avoid spice foods, carbonated drinks, those soft drinks, fried foods, fat foods, acidic fruits like tomatoes, oranges, orange juices, lemon juices. All these, they make the symptoms worse. So at home, you can do lifestyle modifications to relieve these symptoms or to control this condition or to prevent gastritis. Then there are also medications which are used. We use antacids, we use antibiotics. It depends now on the cause. The way we treat it, the medication used depend now on the cause of the gastritis. Yes.
And Doc, are there long-term effects or complications resulting from gastritis. Suppose a patient does not get timely treatment, or suppose a patient defaults on the treatment or does not follow these lifestyle modifications. What are the long-term effects of gastritis?
Okay. The main long-term effects of gastritis is ulceration. Have you ever heard people say, I have ulcers, right?
That's a very
So it can lead to ulceration, which can lead to bleeding, stomach bleeding, and so forth. And also long-term chronic ulcers can also lead to gastric cancers, right? So it can be that worse, that bad, if not treated. So these are the main complications of untreated gastritis.
Yes. Okay, and just on that note, Doc, I know a lot of people will not seek medical attention because they are afraid that their diseases cannot be cured. Is there full recovery from gastritis?
Yes, like I said, it depends on the cause, right? If the cause was alcohol, then if you stop alcohol, maybe it had not progressed to ulcers or cancers. It was still at the level of just inflammation. If the cause was alcohol, if you stop the alcohol, you will recover. If it was H. pylori infection, we can use antibiotics to eradicate that. Then you can be treated. So it depends now on the cause. There's no one answer on that. It depends on the cause of the gastritis.
Well, viewers, as you have heard from the good doctor, that there is always a blue light at the end of the tunnel. There's treatment for gastritis. You're free to come to Belvedere Medical Center to seek treatment, and you're also free to join Save Life Medical Aid. Our contact details are displayed on the screen, and also like and share this video. It's bye for now.